Hello, everybody. I'm really glad to be here today and have the opportunity to talk about the digital transformation at B. Braun. Um, I'm not sure who of you really knows B. Braun. Usually when I introduce myself, the people ask me, that's the company with the shavers and the toothbrushes. No, actually it's not. B. Braun, I think, is a large pharmaceutical and medtech company. I think whoever works in a hospital environment definitely will get to know us. And we have over 5,000 products, simple medical products like syringes or IV sets, liquid remedies, which are also very simple. It's just salted water, I think, which we sell in millions. But also active medical devices like infusion pumps. And unfortunately, we all have seen many of them this year in TV shows, as we have the Corona pandemic situation at the moment where these products will be needed, as well as disinfection materials, protections like masks. That's all coming from us. We have another big branch doing surgical instruments, which is just scissors, clamps, scalpels, but also power tools for operation rooms or implants and other things around surgical things. Here we have a big branch taking care with dialysis, also dialysis machines, and having there also clinical business, and we are also strong in home care business. So it's a very interesting company with a very big bandwidth of products, more than 5,000. Many of them are self-produced. We have a ratio of 95% actually, which we do by ourselves. We do 75 billion euro revenues a year and have 65,000 employees. It's a large company. We are also a family-owned company. We exist since 180 years. There is here a pharmacy that was actually the roots of our company in 1839, where we started. And since then, we did a lot of innovations. We always try to improve efficiency, and we always looked into sustainability. But 180 years means there's a lot of changes inside. A lot of changes coming from technology, coming from economy. We had been grown globally, but we all know this, that today the world is changing faster than ever before. And when we talk about change, it's not just the technological change. I think it's also social, cultural changes, political changes, and so on. And I guess especially this year, during the pandemic, we all have seen how fast things can change. We went in lockdown. This event, unfortunately, is now a virtual event, so we can't see each other. But it also means that we need to adapt to these situations much faster. And that's also part of the digitalization strategy. And we are a healthcare company. And when we're in the healthcare company to say, okay, we are all used to digital platforms. We are all used to use apps and so on. But what does it really mean? We are not a startup company. We are 180 years old. And while a startup company maybe can do things from the scratch, we have some legacy there. And when we started our path into the digital transformation, we actually had been sitting together with startups and asked these startups to say, hey, what's your view on us, on B. Braun? How do you see us? And the feedback which we got was that actually we are part of an old economy. We are supporting a reactive approach. Our thinking is determined by if someone feels sick, he goes to the doctor, and then the doctor gives you a prescription or tells you you have to take care of yourself or send you to the hospital. And that's actually our customers. Our customers are hospitals, our customers are doctors. But the startups told us we actually have a quite different view on these things. First of all, no one wants to be sick, no one wants to be ill. Especially this year, we are so much looking to find a vaccination against COVID, yeah, because no one wants to be sick. Yeah, how we can protect ourselves, and it says we need to be much more proactive. Yeah, and topics are this. We all know this. I don't know who of you is wearing a wearable smartwatch or anything like this to say there's so many opportunities inside. Yeah. This year we see this especially that people try to avoid doctors. Yeah. They're concerned that when they go to doctors, they actually can get infected by COVID. So doing this also remotely with telemedicine plays a big role there. And at the end, we have an increase of chronic patients here, whether it's diabetes patients or patients with stoma or other people. And even look at myself, I'm wearing glasses. You know, I'm actually a chronic sick patient. Yeah, 100 years ago, I would be useless for society. But today, I don't see that anymore. Yeah, today I'm wearing glasses, and I even see glasses as an accessory and not as a remedy to my sickness there. That's the thinking the startups brought to us. And that also, let us all thought, okay, what do we need to change? Yeah? Because we are a mass producer, high volume producer. You know? So the basic equipment on consumables in hospitals are coming from us. If people, maybe with the help of startups and all these things, you know, will not get sick or later sick, that has an effect on us. Might be even a disruptive effect. Yeah. So we needed to deal with that on our path to digitization. The second thing is that we also say the demand, you know, today is a complete different one. You know, we are used to social media, we are used to download apps, we are used to be informed about everything. Yeah, and if you order something, we exactly know when it will be delivered. But on the other hand, if you talk about patients, yeah, we really also have to look into demographics, because we're not just having this young generation, and we also have the older generation, which maybe says, I'm not sure whether I really want to use a smartphone, all these devices. Yeah? And we all need to stay compatible to each other to say, if we offer solutions, you know, what are the kinds of solutions everyone is going to accept? On the one hand, on the other hand, especially these overaging society, you know, creates more and more trouble in our healthcare systems. And you see this on the lower right side, that the costs are increasing, and digitization and technology change can also help to get control over these healthcare costs. Yeah. And especially the technological change drives this digitization. But when we think in technological change, and we did this within Braun, it says, hey, let's try to throw a stone into the year 2030 and try to imagine what maybe are the changes, no? Not only in society, not only in healthcare, but also within the organization. And our hypothesis we are coming up is to say, today we are working more or less transactional. Yeah? If you want to read your emails, you actually open your email client to read your emails. Yeah? If you want to work with an ERP system, you start that ERP system. If you want to design a product, you use CAD software, CATIA, and anything like this. But it's always transactional. Yeah. And we are very much focused on the automation of manual work to say, okay, no one needs to enter data there. We don't want to avoid that, or we don't want to have interruptions from one system to the other. And everyone is talking about mobility, but actually our mobility today is that we are capable to work on different stationary places. Everyone has a notebook, but even you carry your notebook with you whenever you want to work, you need a few seconds, a few minutes that you actually can start. You need to open it, you maybe need to look whether there's a hotspot that you can connect until you can work. And that device, or these devices, which comes close to be really mobile, is more smartphone or wearables, but actually who wants to work on a complex Excel sheet on a smartphone? But when we look into the future, we say it's not so much that we think in different software tools. Yeah, that we say we think in our email client, we think in the ERP system, we maybe think in author systems, or PLM systems and so on. We think in what do we need, yeah, and the system somehow need to anticipate what I need and need to offer me the tool, yeah, with a most probably best integrated interface to do this. Yeah. And it's not about then automation of manual work anymore. It's more the automation of cognitive work. Actually, the intangible knowledge. Yeah, that's the things where we need to do. Yeah, when I look, for example, also into healthcare. Yeah, and into diagnosis. Yeah, usually when I go to the doctor, it's just one person I rely on, that this person has all the knowledge necessary to do the diagnosis. Yeah. But when I can combine the knowledge of all doctors in the world and say, hey, it's not just having the knowledge of one doctor looking on my figures, but on many, you know, that's what we need. And that's where big data comes into place, you know, that really say we can make it capable to do much broader analysis. And of course, getting to these devices, which helps us to make that available at any place. That's what we need to be prepared for. Of course, I just said that data is actually the fuels that drives digitization, because we need to have these digital twins. We need to have a representation of the human body, but we also need a representation of our products, our processes of the environment that really helps us to do this predictive insights, whether it's improvement of processes or it's improvement actually of diagnosis and healthcare. But that also increases the complexity. Yeah, give you a simple example. I said we do not have very complex products. No, that's a very simple product. This is a syringe. But when we see how much data we need to describe this syringe, then we see, okay, we need to deal with the complexity. So that's a little bit the introduction of our thoughts, our hypothesis to enter the digital age. I think our motto is that we would like to protect the health of the people in the world. And to be able to do this, we need to share our expertise with all parties in the healthcare environment. Yeah. So, but also sharing in the digital age becomes a new flavor, especially integration. Integration with patients, healthcare professionals, and also our internal processes will become much more essential to deliver better and faster solutions. So what does it mean for us here? So we are on the path that we set up a digital ecosystem, and a digital ecosystem not only for ourselves, but also for our customers and partners, that we really are able to exchange, to create the synergies here, and to be able to offer actually the outcome of digitization. And the major goal, I think, for everyone in the healthcare is, of course, to create a better outcome for the patients. But also to achieve a better outcome for the patients, we need to be able to increase the effectiveness and efficiency inside the healthcare professionals, to give more offerings to the doctors, to the hospitals. And that goes hand in hand also that inside our company, we have to set up our processes much better to achieve higher speed and less effort. What's our vision? Where we are working on? So B. Braun wants to be the connecting partner in healthcare. And it's really about virtual integration. We would like to have one centralized platform where we can operate our existing businesses, also maybe new business models or new digital products, and share them along our value chain. That really say we have maybe devices for the patient or on the patient, that we can monitor his life. If he uses medical devices, like for example, our infusion pumps, that we know when there's a service necessary to send a service technician, or actually can provide him with consumables when he needs, and even give the chance for doctors then to monitor the status of a treatment, or connect health insurance with the pharmacist, with the physician, with the patient, and so on. That's the models of the future. One essential part for us is the Internet of Medical Things. And that's part of our platform. We call it the B. Braun Health Cloud platform, that enables us actually wherever we have medical devices or smart devices or even packages, whether it's in hospital, in clinics, on the body at home, or inside the community, to actually really being connected. Yeah. And for this, we need to have the digital twins, no? The digital twin of a patient. No? So that's a lot of patient data, which is a curse, as we have to deal with all the regulations there, but also the digital twins of our products to have the control over this. Yeah? That's a huge effort, but it's the right way for us in the digitalization. And we are now producing more and more solutions in that area. You know, as I said, B. Braun has a very wide bandwidth on all the topics. Solutions, for example, are in the area of sterile goods, in the hospital. That we say we help to maintain them. We have for this the tray organizer manager. Or a second, say, big example is our Daheim project. So that's German, in English is at home. And that focuses on dialysis therapies, not inside a dialysis center or a clinic, to give the opportunity for patients to do this in their home environments. And the home environments is also improving the life of the patient. You know, if you have kidney problems, you need to go to dialysis. It's 3 to 4 times a week for 5 hours. You're in the clinic. That takes life away. If you have the chance to do the dialysis at home, then actually you can do this at night, and it improves your life quality. It maybe even let you forget a little bit that you're a chronic sick patient. But to bring something from a clinic environment into a home environment, you really need to have a lot of parties involved, and that's really something, I guess, which only can work in a digital age. We have these dialysis machines, which actually can be connected to a software we call Nexadia, which is a patient information system, but it's also monitoring the treatment. Then we, for example, can provide the patient with having a video call, so for telemedicine, that he's always connected with the doctor, because he's not at home here. And when he feels insecure, he needs to actually have the chance to chat or see the doctor. The good thing is, if it's a connected device, we see whether technical service is necessary. We can do anomaly detection, predictive maintenance, and when there's something wrong, we maybe can even stop the treatment, or we can send a technician. That the patient life is actually not threatened. And being at home means you have no nurses around. Someone needs to help you to put the needle into your arm to get yourself connected. That's a huge effort that you need to learn this. That even e-learning solutions are part of this. And at the end, here you have the clinic, the doctor, the health insurance, the pharmacies, now the consumables for this, the technical service, and they all need to be brought together. That's what we are doing actually on our B. Braun Health Card platform. Another thing is, I think, which is more important, there's so many use cases around, is the patient pathway. Patient pathway, here's one example for the, we call it the For Patient app, that before say surgical intervention, there's a lot of questions. People are not sure. For example, you get a new hip or new knee. It says, hey, what's going to happen for me? What I need to do before? What will happen after? And so on. And there's also a lot of forms to be filled out, and someone needs to take the patients by their hands. And we are all in the digital world with smart apps. We can actually do this, that we connect the patient, the relatives, with the doctors, with the hospitals, and prepare that. And that goes even beyond the surgical intervention. You can later have a sensor, and that sensor being, for example, connected to your leg, measures how you use then the prosthetic, and whether you do it the right way, and can tell the doctor whether the surgical the surgery was successful or was not successful. And that's, I think, just 3 of a lot of use cases which we are developing. But all these things demands it that we get better information about this, that we actually knows about the patient, that we knows about our products, that we knows about this patient pathway, that we knows about the processes inside the hospitals, and we somehow need to grab that physical world and bring it into the digital world. And for this, we have designed an architecture which helps us actually to do this vertical and also horizontal integration into our business. When I talk about horizontal, I says we have this big bandwidth here. We're doing this, say, mass volume products of simple medical devices. We have these active medical devices. We have the specialization for surgeries and operation rooms as well, that we go to the patients. How we are actually able to connect everyone. So that's a question of interfaces. I think the simplest version of interfaces is still doing manual entry, that someone needs to type in the information, or we can exchange data with hospitals or suppliers asynchronous using EDI. And we all are so much used to e-commerce. But the future is not to do this asynchronous, not to do this manual, to do this in real time. I think one big topic or vision we usually talk about is that actually the consumption of one of our products at the patient side should trigger our production and replenish the device or the product to the patient without no one touching it. And that's only when you're completely integrated, because when we see this today, we're in a hospital and something will be consumed. A nurse on the station maybe puts it on a notebook, so manual written. Later it will be typed into the hospital system. Then the purchaser from the hospital is purchasing things to us. There's so many manual steps inside which we need to overcome. So that's what we can do with microservices, for example, with API interfaces to get connected to them. Also the topic, I said that before, with the Internet of Medical Things, that we really get the information directly from products, from packages, and so on, to give that information. That's all about interfaces, and see this as a toolbox. On the other hand, we have a lot of new technologies which helps us to mend these worlds here, whether it's robot process automation, that you have legacy systems which you can bring together, or for us, a big topic is digital process automation. And digital process automation pays into what I said before, this automation of cognitive work, that we actually monitor the way how people are working or doctors are working, and we see if there's a pattern inside. And if there's a pattern inside, then we can guide people to use that pattern and even correct someone. That's really overcoming that people need to have it all in their mind, having assistance. That pays also very much inside the topic to use analytics tools. Blockchain is a topic for us when we think about device regulation, that for an active medical device, we have to make sure that we really have a history record for them, which cannot be changed. We need to show that whoever has repaired that he used the right tools and the right spare parts, that no patient life is harmed. And also the topic, I said that initially, when we want to be mobile anytime, if we really want to enter into virtual environments, now we need to have that technology. And it's a big topic for us, speed, how to come to individual solutions, that it's not only depending on IT, that business departments or even our customers can develop their own solutions on this, having low-code, no-code platforms. That's in the bucket of our toolbox. And then that's for our platform, this Braun Healthcare platform, that we say we can integrate this all. We can have a governance, and we can take care for security, operational security. We make sure that all the solutions are running 24/7, but security also, if it comes to data protection, protection of patient information and so on. But all these things which is necessary are again these digital twins. The digital twins of the products, the digital twins of customers or patients, and also the digital twins of our internal processes, which are a bunch of tools around that. Now that's our overall architecture there, and these digital twins, we call them the digital foundation. And as I was talking the whole time more on what is the offering we offer to customers, to patients, to actually enable that, we also need to do the transformation within our company. And digitalization didn't start yesterday. It started somehow in the 60s Yeah, and starting from the 60s, of course, that was slower than today. We had been collecting data and data, but it's led to a very heterogeneous world, where no one was foreseeing in which world we're living today. So it's also the big challenge that we need to resort our legacy world into the future, where we want to be much more structured into these digital twins and much more thinking in end-to-end processes. So that was a quick run through, I would say, through the path of digital transformation within the Braun. And I'm really looking forward to see what might be questions from your side or having feedback from your discussions. Thank you very much.